Okay, this is the video on how to give a complete and partial bed bath. We're going to skip the complete bed bath part because that's not one of your skills that you need to know for states. However, when we do get into chapter 18 and 19, which is coming up the week after Thanksgiving, we will be talking about the complete bed bath. The difference is the complete bed bath is giving a patient a bed bath from head to toe and they stay in the bed. So you're doing the bath while they're in bed. It involves um, making sharing they have privacy. Usually, the patient cannot do much of the bath themselves, so you are doing it all. Okay, the video is 14 minutes long. The first 11 minutes talk about the complete bed bath. I'm going to skip over to the part where it starts with a partial bed bath. A partial bed bath involves only washing a person's face, hands, armpits, buttocks, and private area. What you do is you set the patient up at the side of the bed, or sometimes you could set them up at the sink, or you could put a basin across the bed and set them in Fowler's position. You tell them what they need to wash and then give them some privacy. When they're done washing, you have them put the color on and you come in and help them finish the areas they could not wash. Okay, so let's start the video. Sorry, hold on one second, guys. Here we go. A partial bath can be found in your book on pages 262. It talks about it. Okay, here we go.
Check your state laws and facility policy to make sure you are permitted to perform this procedure. Before assisting with giving a complete or partial bed bath, check the care plan or the nurse's instructions. Note any restrictions or special considerations. Before you begin, practice hand hygiene. Identify the patient and make sure that privacy has been provided. Follow all additional instructions in the preparation section of this program.
Hi, sir. My name is Ken, and I'm going to be your nursing assistant today. Could you please verify your name and date of birth for me?
David Casey, 7/6/1951.
All right, thank you, sir. I'm going to be giving you a bed bath today. I'm just going to go ahead and gather my supplies. I'll be right back with you, okay? All right, thank you.
To give a person a complete or partial bed bath.
So again, this is starting with the complete bed bath. So we're going to watch it for a little bit, but we're going to skip over to the partial bed bath.
The items you will need should be arranged on a barrier on the overbed table. For a complete bed bath, practice hand hygiene and put on gloves.
We're going to skip over.
After covering the person with a bath, in the video skill, giving female perineal care.
Let me just raise your bed up a little bit. Okay.
To continue his hair and make the bed. These procedures appear in the video skills, assisting with sample, cover the person with a bath blanket. Elements on the person, comb and brush his hair and make the bed. These procedures appear in the video skills, assisting with undressing and dressing, brushing and combing the person's hair, and making an occupied bed.
Okay, this is the start of the partial bed bath. So this is the one that state would have you sign off on. It's one of your skills. It's skill number 6 for state. It's giving a partial bed bath, not the complete bed bath, but the partial bed bath. Need how to do. So we may require you to do it over at clinical on a patient. So this is how you would do it, and you need to know how to do it when you come back to the lab on December 5th.
For a partial bed bath, begin as you would for a complete bed bath. For example, cover the person with a bath blanket. After you've filled the basin, check the water temperature with the bath thermometer. Allow the person to check the water temperature. Put the basin on the overbed table. Place the person in the Fowler's position or help her sit at the bedside.
Do you feel comfortable?
Yes, thank you.
All right. I'm going to put a bath blanket around you.
All right.
That's going to keep you warm. And we're going to get you undressed.
Okay.
Next, help her undress. Provide for privacy and warmth using the bath blanket. Adjust the overbed table so that she can reach the basin and supplies. Ask the person to wash the easy-to-reach parts. Explain that you'll wash her back and areas she can't reach. Then place the call light within her reach and ask her to signal when she needs help or when bathing is complete. Remove and discard your gloves. Practice hand hygiene and leave the room.
I will, thank you. Come on in.
When the call light comes on, return to the room. Knock before entering. Practice hand hygiene.
I'm going to go ahead and get started on your back then.
Very good.
Okay, Alice, I've got our warm water here. And
After changing the bath water as shown earlier, raise the bed to a level that provides for good body mechanics. If bed rails are used, make sure the far rail is up. Ask the person what was washed. Then put on gloves and wash and dry the areas that she could not reach. During a partial bed bath, you or the person should wash the face, hands, underarms, back, buttocks, and perineal area. When you're done, remove and discard your gloves and practice hand hygiene. As you would for a complete bed bath, complete the bathing routine. To do this, give a back massage. Apply lotion, powder, and deodorant or antiperspirant as requested. Help the person put on clean garments and assist with hair care and other grooming. After giving a complete or partial bed bath, perform post-procedure care. For example, empty, clean, rinse, and dry the wash basin. For detailed information, see the section in this program on follow-up care, reporting, and recording.